vaccine coordination is a really big part of our work right now, and it's different. Those that will remember H1N1 will notice that this is a different outreach this time. In H1N1, all the vaccines came to the public health departments, and the public health departments arranged for immunization clinics and did the distribution. This is going to be done differently. It's going to be going to the providers. So providers have already put in their request to be on the vaccination support list. We're starting to get word those have been approved, and the providers are getting their notices that they've been approved. What we don't have right now is the amount of vaccine that's been authorized for each provider, but we expect that in the next couple of weeks. So on the 14th and 15th, which should be a week from now, we expect the federal government to get their approval for the first product, and within a week after that, the second product. That will then go to the state for approval. So Washington, Oregon, and California are going together to do a tri-state approval of the vaccines. We expect that to take 1 to 2 days. So really by the end of next week, probably 17th, 18th, we should see vaccine leaving the distribution points for providers. That being said, we don't know what the amount is. We do know that Pfizer has already run exercises in their logistics chain to make sure they could ship things in the right time period with the right containers to the right places. So they made sure that their system is going to work, which is, I mean, it's a great thing that they've taken that extra step to make sure that the logistics piece won't fall apart. So that's good. We have the COVID-19 vaccination prioritization plan from the state. So, and it's broken out into 4 phases. The first phase is where these first rounds of vaccine are going to be, and I'll just give you a quick rundown. So phase 1 has 3 parts to it. Phase 1A is high-risk workers in healthcare settings, high-risk first responders. Phase 1B is people with comorbid and underlying conditions that put them at significant risk, people living in congregate or overcrowded settings where the majority are people over 65 years of age, and or people with comorbid and underlying conditions, for example, long-term care facilities, farm worker housing, prisons, group homes, homeless shelters. And then 1C is critical workers, the highest risk of exposure, working in congregate settings, for example, agricultural worker groups, food processing groups, those folks who are working in very tight situations. So that's where the initial allotment is going to go. And I fully expect that given the uptick across the state, what will probably happen is that we have the allocations will come out, and then they'll probably put a heat map over it and send the majority of the vaccines to the places with the highest outbreak rates. Right now, Mason County is high at 200, I think we're about 225 cases per 100,000 per 2 weeks. So we took a big jump in the last couple of weeks, more than quadrupling our cases. But that being said, we have places in the state that are at over 1,000 cases per 100,000 per 2 weeks. So we're not in the same kind of category. We have talked with our healthcare providers about, so if we don't get an allocation for Mason County, how do we handle that piece? And the Mason Health has a relationship with providers in Thurston County, and we'll be able to get their folks up there to get that initial, so your emergency room folks, your ICU folks, and people who will be doing vaccinations in the COVID-19 phase 1B and on, will get their vaccinations there. I did talk to the FQHC in Belfair, and they're going to be arranging to get their folks done through Kitsap County. So they'll be able to do the same thing. And they've put in their request to be a vaccine provider as well. So all the pieces are coming into place, and we're getting kind of the wheels under the cart right now. And I think it's going to start going pretty quickly here once we do get what the vaccine is going to be.
Great. And most of those, the charges, the fee for the vaccine is covered, correct?
Right. So
but not administrative.
So the federal government is going to be covering the cost of the vaccine, but each provider is going to be allowed to do a dispensing fee. So I know there's some conversations happening right now with Health and Human Services on capping the dispensing fees for Medicaid and Medicare folks. And then the insurance companies are probably also in that conversation as well. So more to follow on that. So that's still out there, and that's coming down from the feds.
Right.
And I think, if I recall, I think Governor Inslee was also talking about capping dispensing fees in the state at whatever Medicaid, Medicare would pay. So I haven't heard that come down in rule yet. We haven't seen that, but I know that conversation's being had.